On the COVID front tonight, reasons for optimism in Texas and for those hoping for a vaccine. But overall, the news, it remains grim, with states that had beaten the curve now seeing their numbers climb again. Let's start with vaccine news tonight. Here, Dr. Fauci.
We hope that as the time we get into the late fall and early winter, we will have, in fact, a vaccine that we can say would be safe and effective. One can never guarantee the safety or effectiveness unless you do the trial, but we are cautiously optimistic that this will be successful.
Now, other than that, the only bright spot, and it's a relative one, is Texas, where even their good news comes with some bad. Now, for all of that and more, let's bring Andrew back in.
Well, Rich, let's begin in Texas, and to our viewers in Houston and Dallas, you're the only ones who made this list. It's the good one. States where we broadcast that's seeing a decrease in the COVID cases. Texas is the only one. We'll get to the Lone Star State's bad news in a moment. California, Connecticut, and New York holding steady in their number of new cases, but all of these states are going in the opposite direction, basically a block of states from Virginia north to New Hampshire. And there's a real worry seeing New Jersey in particular back on that list. Their new case rate is up 112% over the past week. Governor Phil Murphy blaming house parties for the increase. Taking a national perspective, the numbers right now are near record highs and threatening to go even higher. The U.S. saw more than 67,000 new cases yesterday. That's just off the record high set in the past week. Yesterday also saw more than 1,200 COVID deaths as that curve at the bottom rises to its highest point since the initial wave hit this spring. And it may get worse soon. Homeland Security's hotspot triage report has identified 98 emerging hotspots in 30 states. They include 3 counties in New Jersey, Camden, Mercer, and Atlantic, as well as Madison County, Texas. That's between Houston and Dallas. And there could be others, maybe even the county in which you live. But we don't know because for some reason we cannot comprehend. Homeland Security does not publicly release that report or warn the counties or states. We got this info, as you can see, highlighted only because ABC News obtained a copy of the report. Also in Texas, the situation at the Starr County Memorial Hospital, that's in the heart of the Rio Grande Valley. It's now so bad there, they're allowing the most seriously ill patients to go home so they can die at home. And you'd think the White House would make a point of sharing more information, not less. There are the president's political fortunes to consider, not to mention his friends and supporters. One of them, 2012 presidential candidate Herman Cain, died yesterday of COVID. It's believed he got it at Trump's rally in Tulsa, where Cain, photographed there, was not wearing a mask or socially distancing. His death has at least one Republican scared for other non-believers of science.
Herman Cain was a buddy of mine. I appreciated every moment I got to spend with him, and my heart goes out to him and his family for this loss. The reality of it is, for those who don't think this is serious, that those who think that this is some made-up, China virus that was imported into the country, live in that bubble, and you will die in that bubble, and that's all that can be said.
You will die in that bubble. And as all this is happening, the debate over reopening schools continues with a new warning coming from summer camps. The CDC studied a breakout at a camp in Georgia in June. 344 campers and staffers were later tested. 259 tested positive. That's 3 out of every 4. Indications that kids not only can contract it, but spread it with ease. And yet the Trump administration continues to push to reopen every school, despite the numbers and the spread, despite polling that only 10% of parents think schools should return to normal this fall, and despite teachers' unions threatening to strike if members are forced into classrooms where they don't feel safe. Rich?
Andrew, thank you. Now, given all that, is it even possible to open schools safely this fall? We all want to, but can we? And even if we do, how would it work? For answers, we turn to Dr. Jennifer Nuzzo. She with the Testing Insights Initiative at Johns Hopkins Bloomberg School of Public Health, which has been among the world leaders in COVID data and analysis. Doctor, thanks for a few minutes. And I start our conversation in maybe a peculiar place, but Major League Baseball. Tonight, 20% of the teams aren't going to play that were scheduled to play because of COVID. And I ask that, and I bring that up because Major League Baseball, with a seemingly limitless budget, with a controlled environment, with on-staff medical professionals and a testing system where every day they're tested, if they can't manage being able to play games with all the financial ramifications at risk, How do we think schools with limited budgets that are hemorrhaging because of no revenue coming in the states and the federal government not making up the shortfall, how do we expect them without a single coherent directive to open up safely in the coming weeks?
Yeah, it's a really difficult situation, and I think that's an appropriate comparison for us to consider. I think we can learn a few things, though, from the baseball situation. One is that the easiest way that we're going to be able to reopen schools safely is to do so in the context of having low levels of infection in the surrounding community. And so that's probably not a number of places in the United States. There are places in the U.S. that I think meet that criterion, and they're going to be better positioned to think about reopening schools. But for other places, what they're going to need to do between now and reopening is very much get their epidemics under control.
So, Doctor, let's do questions working off a hypothetical that parents at home here, and I've been opening up the phone lines with regularity, and I'm shocked at the near unanimity of parents that think they're not comfortable with sending their kids back. I figured it'd be more reflective of, listen, I got 3 kids. I want them to go back to school. I understand there's risks attached here, but my concerns are more in the impractical element of it, coupled, I guess, with the medical. But let's say you got a household and they got 3 kids. They got, let's say, a 4th grader, 7th grader, and a sophomore in high school. So kind of covering the bases between primary and middle school and high school. A kid goes to school and all of a sudden they have a positive test, let's say in the middle school's class. The idea that they're only going to be able to shut down that one class is farcical to me, because by the time they find out that one kid in the class has a classmate who's positive, who knows what they brought to their household? Who knows who they came in contact in the lunchroom or on the school bus or anywhere in between? Isn't the biggest challenges for schools, even where you have a low number of positive cases in a community, that once one kid gets it, by the time you figure out, you don't know who they've come in contact with, and you got to shut the whole place down?
Yeah, so I think the scenario that you outline is a reasonable one. The other thing is, what safety protocols can we put in place to, first of all, minimize the possibility that somebody brings the virus to school, but that if they do, that they do not expose more people than necessary. Basically kind of creating bubbles of people that only really interact with each other throughout the day, a limited number of people for just that scenario exactly.
Doctor, in your scenario that you laid out, what frequency of testing and what time period to get results back would be required to at least know what we're dealing with the population that's coming into the schools? And again, I know obviously you know this, and I think most of our audience, but even if the child's asymptomatic, doesn't mean that they couldn't potentially be a carrier as well. So how do we know what we're dealing with the population of kids coming, and how fast will we know maybe who they spread it to?
Yeah, so unlike baseball, I don't really imagine that we will get to the point where we're routinely testing students and staff in schools. We don't have that kind of capacity, and there still may not be enough tests to find all the infections that are out there, but also that the test results are taking way too long to come back. And when that happens, it's going to be really hard for communities to use the test results to intervene and to slow the spread of infection. I mean, one of the things that we do have to consider is that mask use will, I'm sure, be required in schools. It needs to be required, and that should help, that if somebody is infected and doesn't know it, reduce the probability that they can pass it along to others.
Well, Doctor, you say that, but we're broadcasting in certain states right now where masks aren't mandated. So I know that seems beyond the pale of logic, but you could have situations where teachers aren't wearing masks. Imagine the faculty lounge on that conversation. Or certain kids come to school without masks because it's not a requirement, since we have 50 different seemingly rules going on simultaneously right now. But I talk to superintendents, and these are some of the questions they say to me when I say, well, what do? They say, of course we want to reopen. They don't know right now how many of their teachers are going to come back, either because they have underlying conditions, they're in an obviously more of an acute age group where they have their concerns, or maybe a family member sick. So they don't know the population that's at the front of the class. So when I say, well, you can try and spread the kids out more, they say, tell me how many teachers I have to do that with. Then I say, well, what about school buses? They say, show me where I have the funding to increase the number of school buses so I can have fewer kids on a bus at every time. And then I mention air filtration. They laugh at me because in New York, at least, malls were required to put in air filtration systems to be safe for customers, but that's not a requirement in certain schools. So with all these moving targets, if you're the superintendent, how do you navigate this when you have a limited budget and an unknown, let's say, denominator in terms of teachers, buses, etc.? It's a moving target, isn't it?
Yeah. So how do you navigate it? They can't. I mean, it's not fair of us to ask individual school districts to sort through these incredibly important issues that have profound society-wide consequences. School districts obviously have to be lead in these issues, but they can't do it alone. They absolutely need outside help and outside resources. But I completely understand the frustration of the school districts. They've been basically left on their own to sort through what is essentially a society-wide problem.
Amazing times. Doctor, I appreciate a few minutes today. Thank you.
Yeah, thanks for having me.
So up next, the White House continues to say the economy is going to be just great, just like that. Well, every bit of economic data says no, it won't. So what do the experts say? Well, we'll talk with the former governor of the Federal Reserve next.